everybody. It's Kendall, transformational life coach. All right, I wanted to talk to my black people for a moment, and this is not excluding anyone else. Anyone can watch this, but I'm speaking to my black people, and I want to talk about health. We are checking out in huge numbers with diseases and issues and certain things that we could potentially avoid. A lot of black people, you hear them say, well, it's in my genes, it's hereditary, my grandmother had this, my mother had this, my grandfather, great-grandfather had this, my father had this, and we're thinking that we're supposed to pass along ailments and issues and health disparities and health complications. But that's not the case. And a lot of black folks, I'm just going to put it out there, don't eat the way they're supposed to eat. You have some old-fashioned people like, I'm going to eat it, I'm going to die from something. Now, not all black people. A lot of black people are conscious about what they're putting in their body. I know I am, and there's so many more doing that. But some of the older generation, they're not ready to change. They're saying, well, great-grandmother ate this and grandmother ate this and I'm eating this and nothing's wrong with that. And this person lived to be 100 and they ate that way. And I get it and I understand. But this had me thinking when Bismarcky passed away and so many people I know who have diabetes who are black. And I would say, well, you can change some things. I had a lady that was close to me, an older lady, and she had diabetes. And I was like, well, don't eat this and don't eat that. And she would eat what she wasn't supposed to eat. And then she would take her insulin and then she would have trouble and say, it's because I ate this. And the willpower wasn't there. Like, if you know you're not supposed to eat something, don't eat it. If you know something is going to flare up something, don't eat it. Don't just say, well, I can just take my insulin shot. No, make sure you try to eat the right things. And a lot of people are checking out of here with certain things that they can avoid. Exercise, eating. I just want to implore everyone to really look at what you're eating, and now you can Google search the things that are eating and what they do to your body and the inflammatory agents and all of that. And I want you all to just really take care of your health and not pass down generational health issues, because what you're doing is passing down the way they ate, and it can be avoided. Be an advocate for your health. This is Kendall, transformational life coach. And I want you to be able to stick up for yourself when it comes to your health. Even if you're a demure person, even if you're a person that doesn't want to question authority, meaning the doctors, even if you are the type of person who doesn't like pushback or you don't want to do that, become aggressive when it comes to your health. Ask questions. If they say testing, for instance, colonoscopy testing is at 50. Now they change it to 45. But if you feel that you have probable cause to get it at 40, then push for that. Even with insurances, if you push for certain things, they will allow you to get these things done, these tests. It's so important to ask questions when it comes to your health. Do the research. If you can research trying to get a new car or a new house or this bike that you want, you can research your health. The things that you eat, what makes you thrive, the things that you eat, what makes you weak or what makes you prone to certain diseases. You can be an advocate for your health. You can eat foods that make you better, even when you have sicknesses and illnesses. You definitely want to go to the doctor and you want to get a full workup checked out. Even if you don't have insurance, there are places, clinics around the country. You would just have to do your research to try to get these things done, especially tests like mammograms, prostate exams, colonoscopies, and breast exams. So many different things that a lot of communities will give you for free. And I hate to see people who could possibly save their lives and save themselves, not do it because of insurance or lack of knowledge. I want you to really advocate for your health. And if you're not that person, get someone with a big mouth. Get someone who can go with you and ask questions if that's not you. Because I don't want you just to be on medicine for the rest of your life, and you may not have to be, or you're just taking the opinion of one doctor saying that you need this and that. Do your research, do your homework, maybe see another doctor, maybe go the holistic approach, maybe try to ask around, but just be an advocate for your health. Because if you don't do it, it may not get done. And I want you all here and around, but I want you to thrive and be healthy, not just sitting around sick, full of medication. So be an advocate for yourself and for your health.